in head of our health desk, Fred Smith, has joined me back in the studio. I'm going to read some of your messages, but we'll talk about the countries and the actions that have been taken. The latest being California, that has had to go into a lockdown. Let me bring you some of the messages. Fred, it's good to have you back. What information can we share with our audience as far as the situation in California is concerned?
Well, we told you earlier about California that's been on a lockdown. Yes, indeed, more details coming up. They are in a lockdown, 40 million population. That's more than Ghana. Ghana has an estimated 30 million.
Yeah, thereabout.
Everybody must stay indoors. Nobody's supposed to move about. Part of measures to contain the situation, the governor who has been given the orders says that it's important to enforce this to ensure that they're able to control the spreading cases in California itself.
Right. So we'll show you some. Here are some of the videos that are going round. This is from Sky News. Sky News is talking about what's happening in California. Now it says California placed in lockdown. Italy's fatalities surpass China. So those are the very latest. Trump cancels G7 summit. And NZ bans non-resident, that's New Zealand, bans non-resident arrivals. EU stockpiles medical gear. Fred, I want us to talk about these things. Now, you've mentioned California and what is happening in California. Now, if you want to have a mental picture of the situation, it's like picture Ghana and a bit more lockdown. So that's like 30 million. So
it's about Ghana and maybe Togo.
Okay, so Ghana, that's a bit bigger than that, isn't it? Yeah. Right, but so roughly, to give you an idea, it is the number of people, 40 million, all put on lockdown. And so it means we're here and you can't move anywhere unless you're going to offer essential services. If you're not offering any of those essential services, you're not supposed to go out. Now, there have actually been concerns. People actually think that the United States, the places that people expect a lot more of these things to happen, but not all the states agree for that to happen. And so that's what's happening in California. We'll bring you up to date on what's happening in the other countries. Now, the next one you saw on our list was Italy. And what's happening in Italy, and I said that I'll show you a video of how the people assemble. I almost called you Evans, Fred. How the people are assemble. I mean, it's a glimmer of hope. How people assemble on their balconies and they sing to each other. And those videos, we can find some of that and we share that with you. How is it that Italy surpassed, the situation, if you like, according in terms of the number of people who have died?
That's what happens. That's what happens if you are not able to trace those who've been able to contract this disease and those they've come into contact with. And so it's important that the contact tracing goes on. It's important that the contact tracing takes place, and everybody who we suspect may have come into contact, we are able to track all of these people. Okay,
let's take a look at the United Kingdom. Yesterday we heard from Prime Minister Boris Johnson saying that they will get through this. What is the latest situation in the UK? Well, whilst we get that answer, let me read for you some of the comments that we're getting here. This one is coming from Biposo. Says, taking us back to the NIA, which is a very important issue. Says, if the NIA will not listen to any advice, they should go ahead till things get out of hands. From, say, Ike in Biposo. Gifty, is there any other country that has not been affected? From Isaac Biposo. Isaac, that's a very good question. I'm going to check on the list on Johns Hopkins University and give you that update. But it looks pretty much like a lot more. Almost every country has been affected. I have not seen any report from Madagascar, by the way, which is a part of Africa. I have not seen any report from, say, Namibia. I've not heard or seen any report from Botswana, but we certainly will be looking out for that. We should look at which countries, but this seems to have affected a greater chunk of the world. And so this message says, you send a video and you say this is a must-watch video. Well, I'm unable to watch a video at the moment, and so I will bring you that Well, I'll take a look at that later on. This one is also talking about the NIA. It says the NIA should stop the Ghana card registration. They should leave the man who was arrested because he did the right thing. Enoch. Enoch is sending that from Kintampo. All right. So, Fred, I mentioned that Italy has a nice way of doing things, you know, in these very hard times. They assemble.
Well, I'm sure that these are photos
right.
of Italy showing empty streets.
Yeah. Fair.
Okay, showing empty streets, and well, these are patients being taken care of in Italy. So the situation with Italy is that the contact tracing was not spot on, and therefore they got a lot of spike in the cases.
Right. Well, at least the people are doing something very encouraging. They assemble on their balconies, they sing to the health workers who are at the front lines, and they sing a lot of praises to them. Let's take a look at the UK, Fred. What can we...
Well, the United Kingdom, we know schools were shut down today. Other measures are also in place. And in the United Kingdom, similar measures as we have here, some flights have also been banned. You can see the Prime Minister there, Boris Johnson, announcing those measures which took effect from today. And so also stricter measures in the United Kingdom to try and halt the spread of coronavirus there.
And talking about Italy, I'm just getting a message from someone in Italy. He says, Gifty, I'd like to say, ask in fact, what the people in the queue to register for NIA, what is wrong with them? Ghanaians are joking. Here in Italy, everyone is indoors, so we have to be very careful.
That's actually the concern of the Ghanaian students. You recall at a point during the peak of the Chinese crisis,
yeah,
they were asking that we bring them home. They stopped saying that.
Well, I think that the point that people made was that this country has a better health system that could take care of you in case of any eventuality. Now, here we are. We had the Minister of Health today say that these are dangerous times. He's saying we're anticipating 1,000 people have come into contact with these 16 confirmed cases.
Indeed, and God forbid, there shouldn't be any one of those in the Eastern region trying to get a Ghana card. If that happens, we are doomed.
We certainly are doomed. And Fred, I have about 200 messages here. Each of them is talking about the NIA. People don't seem very excited about this. Right now, I just got this from Mutala in Nalerugu in the northern region. He says, northeast region, says, good afternoon. The NIA exercise is controllable. So why can't they stop it for now? Or are they telling us they are not part of the gatherings that the president claimed? God save us. We'll be doing sports shortly. But Fred, what more can we know? Can we talk about Spain? Well,
Spain has also seen a spike in their cases, and they are also facing serious challenges. I think 15,000. Look at Spain now. The streets are empty. Usually, you have lots of people on these streets, and look.
And in this story, it actually tells you what is happening.
Exactly.
There are either people who are leaving the country or people who are providing essential services. And that's a case of Spain. What do we know about Philippines?
Well, Philippines, they've developed some innovation in trying to check the overcrowding or social distancing in their commercial transport operators. So there are some cardboards they've used to partition parts of the vehicle. But in getting in, look, there's overcrowding.
It's a scramble for the bus. But that's another dangerous situation.
Yeah.
Because then if a single person has it,
then everybody around may get it.
Well, let's still see some of the messages you're sending through before we get through to do some sports. It says, please, I have a potent herbal medicine for the COVID-19
He can
disease.
go to, don't lie.
He says, kindly let Noguchi contact me for trials.
He can go to Noguchi, it's at the University of Ghana. He can also go to the Ministry of Health. They will take care of him. The Ministry of Health.
But I actually think this person is joking, Fred, because the details he adds, he's talking about leaves, apple, green to green, etc. So I think the person is just making fun. But, you know, guys, we can make fun of this, and I think Ghanaians like to do that a lot, but we really, need to take care of ourselves.
This time, it is a very serious matter.
All right. So it says they should quarantine them for another 14 days in case they recover fully to be sure enough. I don't know who you're referring to because you don't add any more details.
I'm sure they're referring to the news about 8 persons who were told have recovered, and that has not been confirmed officially. And if that has happened, then this call is legitimate to monitor them. And of course, that's what the health officials do. Even if they test you, they are suspicious, they test you, they still ask you to stay home for some time, and you will be observed and see if nothing happens, and then you can go out and mingle with people. So yeah, that's in order.
Well, Fred, thank you very much. Hopefully we'll be able to do this more and get also experts to answer some of your questions that you may have. This one says, and my final message says, is there a secret that in the NIA registration? May God help us. It's coming from Vicky in Kumasi. Fred, do you have any final words before we go on to do sports?
Well, it's one thing I'll say anytime. Wash your hands with soap and the running water. It's becoming a song, right? Wash your hands with soap and the running water. We use a hand sanitizer, which is alcohol-based, have about 70% volume in it. Keep a distance from the next person, and make sure that you're not in a crowded area. All of these things are tips given by the health professionals. If we all follow, we will be fine.
And we will be fine. And it is dangerous times indeed, but the good thing is you can recover. People have recovered from this, but also it is a scary, scary virus.